Hello everyone. Our names are Joseph and Sophia, and we were the 2020 Bridging the Gap student interns working with Prevention Point Philadelphia. Our talk will surround our work attempting to improve health literacy surrounding pharmacotherapy for opioid use disorder.
Prevention Point is a harm reduction organization located in Kensington that provides a variety of social and medical services. Its mission is to promote health, empowerment, and safety for communities affected by drug use and poverty. Some services that they offer include needle exchange, HIV and hepatitis C care, free meals, mail services, wound care, and housing services. The Stabilization, Treatment, and Engagement Program at Prevention Point supports clients seeking treatment for opioid use disorder.
For our project, we were tasked with creating educational materials that would be helpful for patients enrolled in the STEP clinic. These patients will be receiving various forms of pharmacotherapy to treat opioid use disorder. With that in mind, we brainstormed themes that would be most beneficial for this population group. As suggested by our community preceptor, we started by creating materials surrounding the specific medications that patients may be prescribed in the clinic. This included buprenorphine products like Suboxone, Sublocade, and Subutex, as well as the medication Vivitrol. We also created a document comparing these medications so that patients could make informed decisions about which medication was right for them. When researching opioid use disorder treatment, we discovered a positive relationship between long-term recovery and tobacco cessation. After researching this further, we decided to create materials surrounding tobacco cessation medications and products, as well as a document covering smoking cessation in general and how it relates to substance use disorder treatment. Finally, we decided to create materials on voter education, as many of the clients at Prevention Point may not be aware of their right to vote, how to vote, or their relatively new ability to vote by mail.
Here are a couple examples of resources we created over the summer. On the left, there's a brochure providing information about different smoking cessation medications that are available. On the right is a flyer we made comparing 2 monthly injections available for the treatment of opioid use disorder. Treatments for substance use disorder is very individualized, and we hope that these resources help people feel empowered to take charge of their own care and to have the information they need to navigate conversations with their providers about what treatment might be the best fit for them.
It is estimated that around 2/3 of all Americans with a medication prescription do not adhere to the correct treatment regimen. This is in part due to a long-standing disconnect between patient and medical provider when it comes to information about health. Medical providers often do not take into account a patient's health literacy when they explain complicated diagnoses and treatment options. Without an understandable explanation, patients lose their right to make informed decisions about their health care. Through our work with Prevention Point, we experienced firsthand how difficult it can be to explain medical processes at a grade school reading level and without the jargon that medical professionals use on a daily basis. Educational materials are one of the many ways to help bridge the gap between provider and patient. For these educational materials to be successful, careful focus must be paid to language and syntax to ensure that all patients can comprehend the material presented. As future physicians, it is vital that we present health information to our patients in ways that make sense to them. This lesson will follow us through every patient interaction we have in our careers.
Another takeaway from our work with Prevention Point and from bridging the gaps in general is how important it is for us to be mindful of the language we use. Every person we interact with throughout our career is deserving of respect and compassion, and our language should always reflect this. People living with substance use disorders have historically been marginalized and mistreated by the healthcare system and by the public, and it's our responsibility as healthcare providers to not only not perpetuate any stigmatizing language around the topic, but also to advocate for marginalized groups. Opioid use disorder and other substance use disorders are chronic diseases, and medical language around this should parallel that of any other chronic disease that we learn about. For example, always using person-first language. The language around various issues we encounter in healthcare and in life is often changing to be more respectful and inclusive, and it's important for us to be constantly updating and adapting our vocabulary throughout our careers to always be person-centric, respectful, and compassionate.